of all, thank you all for coming today. We're just so appreciative of you taking time out of your day, and I know that you're going to just enjoy the information and obviously the networking, the ability. I always tell people, nowadays we just don't take this for granted anymore, do we? Not at all, right? It's a very special time that we get to be together. For those of you that don't know me, I've not had a chance to meet yet. My name's Jonetta. I'm a National Marketing Director with the Juice Plus Company, all about nutrition. If you have any questions about that, please come talk to me because I have a real passion for that. But I also am very involved with our chamber. So I serve as the chair of the Health and Wellness Committee. If you're on that committee, please raise your hand. We're so blessed to have a great group of people that work with us to put these luncheons on along with other events. And this year I also get to chair the board. And so that's been quite an experience too. I love doing that and serving in that way. I'm going to take a couple of minutes and tell you a little bit about our committee and the purpose of our committee. It's really a collaborative effort among healthcare professionals, providers, and businesses in this greater Northwest Houston region. And we're all providing health and wellness related platforms to support economic development. So the Alliance focuses really on providing those opportunities which support our healthcare professionals and wellness initiatives because we want a healthy and vibrant community. I love that word, vibrant. You guys are like, I want to see your glowing faces, all right? So the members of the committee, I already had them recognize them. They're all Chamber of Commerce members. We meet on a monthly basis. You all are welcome to attend one of our meetings. That I call it a working committee. I believe networking happens as a result of working side by side with people that you enjoy being with. And we actively have some areas of focus that we really work towards bringing these community lunches. We have different events that we do. And we have our Tomball night, Health and Wellness Expo. That's been going on for a couple of years now. And then we also do some community blood drives. So you'll be getting a little bit more information about that. I do want to take a minute and recognize our lunch sponsors today. So Tomball Regional Health Foundation and MD Anderson. I do have Miss Marilyn Kenyo here today. And we're missing Lynn today. This is the first time we've had a luncheon without him. And so just really keep Marilyn in your prayers and his family. And Miss Marilyn, can you give us a few words?
I just want to thank everybody for letting us be here today with you and sponsoring this great event. If you don't know who we are, we used to own the hospital. We're the old owners. It's been sold. And we give to the healthcare in the community. We give to Tamagua team, Be an Angel, Camp Blessing, Joyride. There's 30 different organizations we fund. And we try to just make sure that everybody's taken care of in our community to the best that we can. So again, thank you for letting us come out and be with you guys today and enjoy the talk today.
And Kendra Windish with MD Anderson, she's been so faithful to our committee as a member, but then also as a sponsor. And she could not be here today, so I promised that I would read this statement from her. The University of Texas MD Anderson Cancer Center in Houston ranks as one of the world's most respected centers focused on cancer patient care, research, education, and prevention. The institution's sole mission is to end cancer for patients and their families around the world. MD Anderson is one of only 51 comprehensive cancer centers designated by the National Cancer Institute and is ranked #1 for cancer care in U.S. News and World Report. They provide cancer care at several convenient locations throughout our greater Houston area. Every day, MD Anderson Cancer Center patients depend on whole blood and platelet donations during their treatment, and the need for these donations is especially great during this time, but the supply is critically low. Donating blood and platelets is safe, and MD Anderson is taking even greater precautions to protect donors and staff. So, and she gives us information. If you're eligible to give, please make sure that you're contacting, get in touch with me, and I'll put you in touch with Kendra if you have questions about that. So again, we're the reason that you have lunch today, and lunch is free, is because of this sponsorship. from both Tomball Regional Health Foundation and MD Anderson Cancer Center. So let's give them a round of applause. Lots of gratitude as well for Lone Star College Tomball for providing this beautiful venue for us. You guys don't know how venues are really hard to come by. And so it's a real blessing that we have this facility here. We're so appreciative for that. And the staff, right? The fact that these microphones, they take such good care of us. And I got here this morning and everything was all set up, and it's just a wonderful place to be able to come. Jonetta Beat Productions, Miss Jonetta is here. She's videoing for us. If you have any video needs, please reach out to Jonetta. She's super great at what she does. We love working with Jonetta.
Thank you.
Yeah. And then I want to introduce very quickly, because I know they're hungry and they're waiting for me so they can eat, right? So we do have some of our featured businesses, and again, if you've not taken time to meet and get to know them a little bit, they are here for you and they want to get to know you. We have 9 Round Fitness. We have Bailey and Charlie back there. Give them a wave. We have, I'll try to go with order, which is not in the same order I have here. We have Violet Macritz, who's a realtor with Better Homes, Gary Green. And then we have Danielle, who is with Grand Canyon University. And you might think about that one, like, why are they here? You need to go talk to Danielle. It's just, I got a whole education the last time I visited with her about that. We have HCA Houston Healthcare Tomball, Sandy Burkholz, and her team. She brought the team today, guys. Make them feel welcome if you've not had a chance to meet them. And we have Miss Pat Justice, who's also a realtor with Better Homes Gary Green, and her specialty is in seniors, with working with seniors. So make sure that you have a minute to introduce yourself to her. All right, so thank you guys. You may now eat, get your lunches. And before we get started, I do want to, we have, Bruce just walked in. Everybody turn around and make him feel special. Wave at Bruce. And if you've not had a chance to meet, Brandy is with Chamber staff. She's been here with us for over 20 years, so we're very blessed to have an amazing staff. So right now, are you guys ready to hear from our speaker? All right, I want to introduce him. And Dr. Kashif Piracha is a dual board certified physician who's actively involved in clinical practice as an academic hospitalist at Houston MethodistWillowbrook Hospital. Dr. Piracha did his internal medicine residency from Memorial Health University Medical Center in Savannah, Georgia from 2003 to 2006. He later completed subspecialty training in all these words, Doc. Nephrology. How'd that go? Nephrology. How's that? From Stony Brook University Hospital in Stony Brook, New York, from 2012 to 2014. In addition to his clinical studies, Dr. Piracha is also the clerkship director in internal medicine for Texas A&M College of Medicine at Methodist Willowbrook site. And in this role, his responsibilities include supervision of didactic and bedside teaching activities of medical students. He also serves on the medical advisory board of Verywell Health. He's a section editor for the General Internal Medicine section of Med Studies Internal Medicine core curriculum. He's currently writing a board review course in nephrology for, hopefully we'll learn what that is, nephrology, for American Physician Institute for Advanced Professional Studies. I've had the opportunity to visit with him on several different occasions, and what I want to tell you is that he has a heart for education. He contacted us because he wanted to provide this service for our community. And so you're in for a treat to be able to hear from Dr. Piracha, and I am going to turn it over to him.
Good afternoon, everybody. Thank you so much for coming here today, and I'd like to extend some special thanks to the Tomball Chamber for giving me this opportunity to speak with all of you guys today, and a very special thank you to Donna Dyson. She really is a great person, and when I reached out to her and I said I want to talk about a medical topic, she immediately said that it's a great idea, and we've been working over it over the last few months. So thank you so much. Let me go ahead and get started. So this is just a disclaimer for my talk. Okay, so the talk is titled Living with Chronic Illness. Now, this is a topic that can take hours and hours, in fact, even days, that you can continue to talk about it, and you probably be just brushing the surface. So this is a very, 30 minutes is like barely 1% that you can touch this topic. I just wanted to highlight some of the important things, but if you're talking about chronic illness, the first thing that you have to do is to define what a chronic illness is. So basically, in medicine, most of the time, we divide diseases into 2 or sometimes 3 groups, acute disease, subacute, or chronic. Now, some of the diseases don't have a subacute phase, they just have an acute and chronic phases, and I'll give you some examples on that. But basically, I would describe chronic illness as a term that's coined for any illness that continues to persist for a long time. The best way to look at it is that every illness starts as acute. I mean, even if somebody has an illness that they've had for 50 years, there was a day one when that started. So on that day one, it was an acute illness. Now, over a period of time, it became subacute or chronic. But how long is really long? You say a long-term disease is a chronic illness. So that's sort of a gray area, because in medical literature, different diseases have different time periods where they change from acute to subacute to chronic. And we'll look at some of those. So like the first one I want to talk about is like diarrhea. So diarrhea is an illness which has a pretty clear-cut definition in terms of acute to subacute to chronic. So anything less than 2 weeks is acute, subacute is 2 to 4 weeks, chronic is greater than 4 weeks. But if you look at pain, again, pain is such a big topic, because what is the pain from? There are millions of diseases. But when it comes to pain, acute pain is very different than diarrhea. Anything less than 6 months is acute. That's a pretty long time. And chronic pain is only if the pain persists for greater than 6 months. There's another disease we call osteomyelitis, basically. It's an infection of the bone. And in that, you say acute is less than 2 weeks and chronic is greater than 6 weeks. They don't even define the period between 2 and 6. I mean, you can practically say that's a subacute phase. But at the end of it, the way to remember is that if an illness lasts from days to a few weeks, I would call it an acute illness. And if it goes on for a few weeks to months to years, it's most likely a chronic illness. So for the purpose of this talk today, we'll only be talking about chronic illnesses. We're not going to be talking about any acute illnesses. So basically, the 5 most common types of chronic illnesses in our society are heart disease, stroke, cancer, diabetes, and obesity. I put down some statistics just to drive home the point that these diseases are sort of like a tsunami presentation, with heart disease and stroke combined kill greater than 877,500 Americans every year. Cancer claims the lives of greater than 600,000. 34.2 million Americans have diabetes, and 42% of American adults have obesity. Take a moment to pause and look at the statistics. 42%, so that's almost every 1 in 2 adults has obesity. And that's one underlying factor that can probably lead to any of these 5 diseases that have been mentioned. So we define chronic illness. Now, what do we do to prevent and treat chronic illnesses? So basically, it's a 7-step approach to dealing with chronic illness. Healthy nutrition, proper exercise, adequate sleep, that's very important, and that's one thing that's not emphasized. We live in a society where we're always rushing, there are always things to take care of, and the last thing that gets most compromised is sleep. But your body will gather all that sleep deprivation over the years and will manifest itself as one of the chronic illnesses if you don't allocate enough time to sleep properly. family history, regular screenings, smoking cessation, and alcohol intake limitations. These are the 7 interventions that, if done properly, can go a long way towards prevention and treatment of chronic illnesses. So for the purpose of our talk today, we're going to stick with number 1. So we're going to talk about healthy nutrition. So when it comes to healthy nutrition, the big component of heart disease and stroke is elevated blood pressure called hypertension. We will look at some of the dietary management of hypertension and the role of salt. So one of the important things I want to talk about is dietary salt. Dietary salt is directly related to developing high blood pressure, and if you have high blood pressure and you continue to eat a high salt diet, it's not going to be corrected. And will just probably end up piling one over another medicine over another medication to treat it. Dietary fats, back in the day in the 80s and 90s, there were diets that there was a common misconception that fats are bad, and there were diets which were very low fat. Over time and time again, it has been shown that the fats are not bad, but the problem is you are eating the bad fats. Some fats are good, some are bad. We're going to talk about it. I'll give you some examples on that, so you can make sure that when it comes to eating fats, you eat the right ones and not the ones that are associated with disease processes. Diabetes is intricately linked to blood glucose levels. We will look at some strategies to control healthy blood glucose levels. But the most important thing is protein intake. This is the most commonly overlooked dietary ingredient. We need to pay proper attention to it. Unfortunately, if you look at the market right now with people talking about weight loss, obviously, like I said, obesity, 42% have it. So one of the most important things is to lose weight. But what people miss a lot of times with all the low carbohydrate diets are the craze right now, and they have scientific evidence that low carb diets work. But what happens is that in all this noise of low carbohydrate diets, what people forget is to make sure they are eating enough protein. And in the bodybuilding community, there is a lot of literature, and obviously they all have a lot of protein, but in the general population, when I meet patients and stuff, a lot of people have awareness right now about carbohydrates and weight loss, but still a lot of people don't really look after how much protein they are taking in. So first of all, let's look at some strategies to reduce sodium intake. So basically, an average American consumer, they eat about 3.6 grams per day of sodium. Men consume about 4.2 grams a day, and women consume about 3 grams per day. But what is the optimal level of sodium intake? So the World Health Organization says it's about 2 grams per day. US dietary guidelines say 2.3 grams per day. American Heart Association is the one with the most strict definition, less than 1.5 grams. So basically, I wrote down, I personally recommend to my patients to do less than 2 grams per day, because I personally feel that the AHA 1.5 grams per day is really hard. And if I put people on it, then they stay on it for a little bit and then they just can't handle it anymore. And it's better to have control rather than just doing it for a short time and then completely falling off the diet. But one of the most common argument that I hear from patients when I talk about salt is that they say, well, if I decrease the amount of salt in my diet, there's not going to be any taste. And basically, what studies have shown is eating a low salt diet is not something you can do cold turkey. That's also a big debate. You know, a lot of people, especially in smoking, you meet people all the time and somebody says, well, you know what, I was smoking for 40 years. One day I woke up and I said, I'm not going to do it anymore. And I'm successful. I just stopped doing it cold turkey. But those are exceptions. A better way to do it is to gradually reduce. And the same goes for salt. Your taste buds will get used to it over time. So if you decrease the amount of salt in your diet slowly, then you're going to be just fine. Just give your taste buds some chance to get used to the reduction in salt content of your diet. So in this slide, you can see that one of the most common things obviously people say is that when we cook our food, we don't put a lot of salt in it, or when we don't use the salt shaker when we are eating our food. But that's all pretty good. But if you look at the whole population, about 68% of the salt that people take comes from the processed food from grocery stores. So again, that sort of is part of the same lifestyle that we all have, because we always have to go someplace and we are in a rush. We don't have time to cook, so we just grab something. That it's easier for me to say don't do that, but the realities of life are definitely much different. But we will look at the best thing is to cook your own. If you can't do that, there are some ways that you can at least be more cautious about what you are getting from the grocery store. But as you can see, the food found naturally in food is just 4%, and added while eating or cooking is just 13%. So restaurant meals 15%. So a majority of salt that Americans have consumed every year comes from processed food from grocery stores. So basically, you can look at the literature and you will see that there are millions of people with recommendations for a low salt diet. But I think at a medical level, every doctor should have their own interpretation of the guidelines and some recommendations of their own. So I came up with these 5 recommendations that I tell all my patients. So we'll go through them one by one. So first is obviously, like I said, eliminate processed food from your diet. Cook food at home with fresh ingredients. If you do that, you're already bypassing that 68% majority of salt. So you're already ahead of many other people. Now, like I said, the realities of life, we have to address them. If you cannot eliminate processed food, be very picky and always read food labels. Reading the food label is very important. I cannot tell you how many times I've had patients who tell me that there's something that they got on the grocery store and they had an instinct that, yeah, that thing is pretty healthy anyways. It won't have a lot of sodium. But when they manufacture it and do other things, you would be surprised. So at least anything you buy off the grocery store, packaged food, please take a moment to look at the salt content. They usually also tell you what percentage of daily intake. Like you may buy one thing and it would say 20% of daily intake of sodium is in that one food. So you know where you are as compared to your whole daily intake. The other thing you can do is, if you have to put salt on the food, you can use a salt substitute. So the normal table salt is sodium chloride. The closest one is potassium chloride. And the taste is pretty similar. In fact, if you replace it without telling people that you've replaced their table salt sodium chloride with potassium chloride, a lot of people won't even know the difference. So it's pretty easily done. The only thing you have to make sure about, and that's one disease I'm not talking about today, is that your kidneys have to be healthy, because potassium is one thing. Substituting sodium for potassium is great for high blood pressure. But with the only caveat that your kidneys have to be healthy, because if your kidneys are not healthy, potassium can accumulate in your blood and that can have bad effects. So if somebody has high blood pressure and they also have kidney disease, I'd probably not use this third point of substituting with potassium. Fourth point is eat more fruits and vegetables. All the fruits and vegetables are mostly low in sodium. That's pretty good. And when eating in restaurants, avoid soups and broths. If you've noticed, whatever restaurant you go to, they put a lot of salt for some reason in the soups and stuff. And also, if you are in an Italian restaurant and they give you the bread before your meal, please make sure to tell them not to put salt on it. A lot of times they put salt on it. That's just extra salt that you really didn't need. And then one thing you can do is, a lot of times if you go to a restaurant, they always have make your own option. Make your own pasta, or make your own omelet, or make your own whatever. You can choose that, and then you can tell the cook that you would like to get that prepared with lower amounts of sodium that they usually put in. You can just say put half the amount. That way you're making sure that your food is prepared to your specifications and what you ordered. Okay, so that's it for sodium. Now let's talk about fats. Okay, so like I said, fats are not bad, but some fats are bad and some fats are good, and it is our job to differentiate among them so we know which ones we should be eating and which ones we should not be eating. So 1 gram of fat equals 9 calories, and again, because the time is limited, I didn't have an opportunity to go in more details, but what it actually means is that I'm sure a lot of you have heard the term basal metabolic rate. So what happens is that, you know, whatever we do in our daily lives, there is a certain number of calories that our body is going to burn just to be alive. Because breathing, digestion, walking, talking, everything takes some calories. And it's a big topic because the more physical you get, the more the calories that you're gonna burn. The good thing is the more calories your body burns in a certain state, that gives you opportunity to eat food with more calories, because if your body is burning more, you can eat more and you won't gain any weight. So what happens is that if you take in a gram of fat, that gives you about 9 calories. So if your basal metabolic rate, let's say roughly 2,000 calories a day is what your body is using to survive, you have to make sure that you don't eat many more than what your body is using, otherwise the remaining ones will be added on as fat. So every gram of fat has 9 calories. So suppose you take in 10 grams of fat, that's about 100 calories for the day. The problem is that if you look at a gram of a particular micronutrient, fat is the one that gives the most calories, so 9. We'll look at protein and carbohydrates, which are 4 calories, so you can eat more of those. So there are only 4 big types of fats, and 2 are bad and 2 are good. So saturated and trans fats are bad, and monounsaturated and polyunsaturated fats are good. So again, food labels are great. If you're buying something and has a label, they usually write down the type of fat as well. They'll label total fat, they'll say trans fats, saturated, and poly or monounsaturated. If you're cooking on your own, one rough rule of thumb, it doesn't apply all the time, but bad fats are usually solid at room temperature, like butter, and good fats are usually liquid at room temperature. Remember, room temperature, like canola oil. So over and over, the studies have shown that saturated fats and trans fats are directly involved in raising LDL cholesterol. That's one type of cholesterol that's the worst of everything. It is associated with plaque buildup in your arteries, and that can lead to heart attack, stroke, other diseases. We will look at some foods that you can eat and some foods that you should avoid to take in the right types of fats. So again, like I had my 5 points for sodium, these are my 5 points for eating appropriate fat. Now, the 5 items to eat less of, and you know, you're gonna have to be steadfast in this because most of these are very tasty. So that's, I can't change that. That's just how it is. Butter, cheese, coconut oil. So coconut oil and palm oil are an exception because even though they are oils, they are high in saturated fat. All the cakes, cookies, pies, unfortunately, they're big time saturated fats. Any kind of cream, sour cream, ice cream, whipping cream, they have a lot of saturated fats. Fatty cuts of meat. That's why anytime you read anywhere when they talk about meat, they say lean sections of meat. That's what they're talking about, without the fat. And then fried food like fried chicken, anything you can fry, that will have saturated fat and trans fat. But some of the things that actually you can eat and they don't have a lot of bad fats, only good fats, are olive, peanut, and canola oil. So when you go to an Italian restaurant and they give you the bread that you have to dip in the oil is an olive oil. So olive oil is good. I don't know how good bread is, especially you eat a lot of it. Avocados are great, but again, high in potassium. So people with kidney disease, they're gonna have to stay away from this one. Nuts are good. Almonds, hazelnuts, pecans, walnuts, they're pretty good. Seeds, sunflower, sesame, and pumpkin seeds are good. And the best meat that's available is fish. Unfortunately, that's time and time again. Fish has been shown to have so many benefits to it. And you can eat salmon, tuna, herring, trout. Again, for all of these options, obviously you're not going to deep fry them. So you're going to have to find another way to cook. But don't deep fry, but you can use some of these items, and they are high in mono and polyunsaturated fats. And that would make sure that you are eating the right types of fats. Again, don't remember the important thing I said earlier. Whatever the fat is, whether it's good or bad, 1 gram will give 9 calories. So if you eat a lot of nuts, you can easily exceed your daily quota of calories of 2000, whatever 2000, I'm just using it as a rough guide. So you always have to make sure you eat with some restriction so you don't overshoot your daily quota of calories. Okay, so let's take a moment to talk about blood glucose. So everyone knows that diabetes causes increased blood glucose levels, and that having a high blood glucose level chronically is a bad thing. That almost everybody knows. So here comes the glucose. 1 gram of glucose or carbohydrates will give you 4 calories. So technically, you can eat double the amount of double the amount in grams of carbohydrates than fats, and would still have the same amount of calories going towards your daily quota of 2000. Now here it gets a little technical, but I always feel like a basic understanding of how glucose and insulin work is actually good for everybody, just because there are so many people with diabetes. So what happens is that when we eat any food that contains carbohydrates, the food is broken down in the stomach, and ultimately when the digestive process is complete, the micronutrient that's going to be released from the food is glucose. Now you eat the food and your blood glucose level goes up. That's normal. So what does your body do? Now the glucose is in the blood, but what happens is that every cell of your body needs energy to stay alive. The body is alive because the cells in the body are alive. If the cells in the body will die, the body will die too. So at a cellular level, every cell needs glucose. So what happens is that the insulin hormone that's released by the pancreas, its main job is to move the glucose from the blood into the cells. That's the most important aspect of the whole process. We don't want people walking around with very high amounts of glucose in their blood. They eat a meal, glucose level goes up, insulin pushes it into the cells, brings the blood glucose level down, and that's the best state of living. So now what happens is that when diabetes develops, there are two things that happen. Either people pancreas doesn't make any insulin. So there's no hormone to remove the glucose from the blood into the cells. But then the other thing that happens is sometimes the pancreas is making insulin, but it doesn't work. At a cellular level, people develop a resistance to insulin. So that's a complicated process and beyond the scope of this talk, but what happens is obesity plays a big role in it. So obese people, when they have type 2 diabetes, they make insulin. They actually make more because their pancreas makes more because their blood glucose level is always high. The problem is because of obesity, the insulin doesn't work and they keep having high blood glucose levels. And the tissues and cells that need glucose to live, they don't get any glucose. That puts a lot of strain on the tissues and the cells, and slowly and gradually they start dying. And one of the features of this is the end organ diseases. Like you must have heard, diabetic people, again, they develop heart disease. That's because of damage to heart muscle. People have kidney disease because of damage to kidney. They have eye disease. every cell in the body, almost every tissue needs glucose. You mess up this mechanism, almost every tissue in the body will be affected. That's sort of the way to explain it. So what happens is that there are many treatments for diabetes, but one of the things is if you have any disturbance with the mechanism of insulin, it will be a good idea if you really don't eat too much carbohydrates, because then your glucose level will not go up, and even if you have insulin resistance or deficiency, the side effects would be minimal because your blood glucose level is not getting as high as if you were eating a high carbohydrate meal. So just like I divided the fats into good fats and bad fats, carbohydrates can be divided into two groups too, starchy and non-starchy carbohydrates. So the starchy carbohydrates, they increase your blood glucose more, so try to eat less of, and the non-starchy carbohydrates increase blood glucose less, to try to eat more of. So what are the starchy carbohydrates? Whole grains, bread, pasta, rice, oatmeal, tortillas, some vegetables too. It's a common misconception I see a lot of times, because generally fruits and vegetables are healthy, but be aware that not all vegetables are healthy. Potato, sweet potato, plantain, they have a lot of starchy carbohydrates. That's a bad type of carbohydrate that you don't want to be eating too much of. And beans and legumes also have kidney beans, pinto beans, garbanzo beans have starchy carbohydrates. So, but remember I said eat less of. I did not say do not eat at all. So moderation is always important. I'm totally against any kind of very strict dietary recommendations, because if you exclude one big group of foods from your diet, over and over again I've seen that ultimately the patients are unable to continue to do that, and they go back to just no restriction at all, which is definitely what we don't want. So non-starchy carbohydrates are the good ones. Other than some of the vegetables I mentioned, most of the other vegetables are actually pretty good. Broccoli, cauliflower, cabbage, eggplant, tomatoes, mushrooms, these days, cauliflower is also being used to make pizza. The dough is made from cauliflower, so that's something that's a good idea. That way you are avoiding a lot of starchy carbohydrates. So that's about carbohydrate. What about protein? Okay, so protein is very important because, and it's not given that much importance, but why are proteins so important? Proteins are the building blocks of the body. They're primarily present in the muscles. They give strength and energy. I mean, more than half of my patients that I see in the hospital, the biggest complaint is that they don't have energy. Well, if your muscles are not strong enough, you can't walk farther, you can't climb the stairs, and you're gonna feel weak and you'll get shortness of breath. 1 gram of protein, like carbohydrates, has only 4 calories, so you can eat a little bit more. Now, daily requirement is about 0.8 gram per kg body weight, which is 800 milligrams. But that's just for a sedentary individual. If you are somebody who walks, who is active physically, you need almost double that amount of protein to about 1500 grams or 1.5 gram per kg body weight for an active person. Sorry, I said 0.8 grams, that's 800 milligrams, yes. 800 milligrams to 1500 milligrams of protein a day for a sedentary versus an active person. So if you lose muscle mass due to inadequate protein intake, it leads to weakness, increased tendency to fall and suffer a fracture, poor gait, loss of balance, increased tendency to get infections. You can get more infections if your muscle mass is low. But the next point is the one that I always find very fascinating. So remember how I said that in a normal resting living state, you need about 2000 calories? Well, guess what? If you have a high amount of muscle mass on your body, 1 pound of protein burns about 7 to 10 calories a day, whereas 1 pound of fat only burns 2 to 3 calories a day. So if you take somebody who is a 70 kilo person and they have more muscle on their body versus a 70 kilo person who has more fat on their body, what will happen is if both of them have the same amount of physical activity every day, the person with more muscle can eat more food because they are burning more calories, even though the gross weight for both people is 70 kilos. It's just that muscle burns more calories. Even when you're sleeping, your muscles are burning more calories. So it's a double benefit. You will have more energy to do your daily activities if you have a high protein diet, and you can afford to eat other types of foods a little bit more, so you won't go that hungry. So one of the things that's most important for anybody, I don't care it's a 20-year-old or an 80-year-old, like you can take the day to day, whatever protein, whatever muscle mass you have today, one of the best things you can do for yourself is to make sure you don't lose any of it. I mean, that's the basic minimum. I mean, if you gain more, that's great, but gaining takes time and effort, but at least try to make sure you don't lose any. What happens is, as you go through aging, one of the most common things that happens is that we lose muscle mass. That's a natural progression of events. So what I'm saying is a 20-year-old kid probably doesn't need to lift that much weights to gain muscle, but a 50 or 60-year-old person might need to lift weights just to protect the amount of muscle mass they already have. And one of the things that you can do is just to make sure you eat enough protein every day. That will go a long way, even if you're not doing any resistance training, in at least making sure that the muscle mass you have, you don't lose any of it. That's the most important thing. So what are the 5 best foods to eat for high protein intake? These are my recommendations. Lean beef and chicken. Fish, we already talked about, almost all fish, but some of the ones with a higher protein content are cod, salmon, and halibut. Eggs are great. Believe it or not, some vegetables have a good amount of proteins too, especially the green leafy vegetables. Broccoli, spinach, asparagus, you can eat some of those, and lentils have a lot of protein content too. So, but then again, there are supplements available too. That's not part of this talk, but if you don't like these diets or you can't get enough protein from these diets, you can always supplement with a high quality protein. But at the end of the day, make sure you eat enough, that your body requirements are fulfilled. Okay, so almost coming to the end of it. So what's the biggest challenge my patients face? So patients tell me all the time, they say, you know, doc, I have high blood pressure, I have diabetes, I have high cholesterol, and so one of the diets says this and this, and if I incorporate all the diets, there's really no food left for me to eat. So that's a big problem, yeah, because obviously, you know, time and again it has shown that any kind of diet that doesn't fulfill one big purpose, the taste. We all need to have food that's tasty, and that's different for everybody. But if you put yourself on a diet which is not tasty by your standards, you will never be able to do it in the long run. I mean, that's just not gonna happen. Because what happens is, you know, you can put yourself on a diet, but then when you get stressed out about something, you know, that stress, job, work, relationships, you'll feel that that strict diet you put yourself on is gonna be the first one that's gonna be thrown out the window. Because when people get stressed, you can't be hungry and you can't have really non-tasty food at that time because you need to focus and think to solve your problems. So basically, I came up with this sample diet that basically, you know, anybody is willing to try, you can try it. It's just a sample diet I put together that I sometimes tell my patients, and there are a couple of important things about this. One of the things that I'm as a doctor, my personal bias is that I want to make sure that every meal you eat is whole. Meaning, I don't want you to eat all your protein content for lunch and all your carbohydrate content for dinner. Now, if you look at 2,000 calories a day, you can say, oh, that's fine. I can split it up whichever way I want. I'll have 1,000 calories of carbohydrate until 3 p.m. and from 3 p.m. onwards, I'll do 1,000 of protein and I'll be done. That's not really the physiologic way of doing it, and that's not really how your body works. So one of the things that I always advocate is what you should do is to make sure that all of your meals are balanced. And that will make sure that even from a carbohydrate standpoint, like just we talked about, if you eat too much carbohydrate at one time, your blood glucose level will go through the roof. And if you have diabetes, you're going to have problems. So you only want to eat a little bit at one time. So suppose for breakfast, you can have 2 large fried eggs using a little spray oil. That will give you about 15 grams of protein, 14 grams of fat, and 188 milligrams of sodium. You can have a medium banana. That's your starchy carbohydrate, 28 grams carbohydrate, 450 milligrams potassium, and sodium 1 milligram. One of the good things about bananas is they have high potassium. Again, for those people who don't have kidney disease but have high blood pressure, that's really good. You want to substitute your sodium with potassium. You can have some 8 ounces low fat or skim milk that will give you 2.5 grams of fat, 13 grams carbohydrate, 400 milligram potassium, and 130 milligram sodium. So that's the sample breakfast. Then for lunch, again, it's balanced. You can have a grilled chicken breast, 6 ounces. That'll give you about 40 grams of protein, 12 grams of fats, and 686 milligrams of sodium. A cup of eggplant will give you 4.8 grams of carbohydrate, 0.1 grams of fat, and 400 milligrams of sodium. And Greek non-fat yogurt, 150 grams, will give you 6 grams carbohydrate, 0.7 grams fat, and 17 grams protein. So again, if you look at the meal, you will notice that it's intentionally kept balanced, especially when it comes to the protein and carbohydrate and fat content. And the fat content is always less than the protein and carbohydrate because, like we talked about, a gram of fat will burn for 9 calories. So we cannot really eat that much. We have to stay within our daily quota. And for dinner, you can have a chicken wrap with a grilled chicken breast, 31 grams of protein, 42 grams carbohydrate. You can have avocados, again high in potassium for those people whose kidneys are functioning well, 12 gram carbohydrates, 21 grams fats, and some asparagus. But again, the point is avocados have a lot of fats too. So that's how I kept the dinner balanced between chicken and avocados. You're getting protein with the wrap, the tortilla, you're getting the carbohydrate. With avocados, you're getting the fats. So if you look at this sample meal, what you'll realize is that you are getting about 400 to 450 calories from carbohydrates and protein, and about 450 from fats too. So that all of that, if you add together, only comes out to about 1,300. The reason it's 1,300 and not 2,000 is I didn't include any snacks in it. So obviously you want to leave some room for snacks. And the sodium content at the bottom is kind of a little bit on the low side, 1,400. I said earlier I don't advise anything less than 2 grams, but again it's a little low because snacks are not included. So the point is just try to make sure that every meal you eat is balanced, and at the end of the day you don't eat so much food that your body can't burn because the rest will be put on as fat. One of the things I forgot to mention in the protein section was that in addition to making sure you take care of your daily requirement of protein, like I said, 800 milligrams for sedentary people and about 1500 milligrams per kilo body weight for people who are more active, try to do some resistance training. That's lifting weights. That can really help with the muscle growth. Again, I totally understand. Most of my patients have arthritis. It's not that easy. Some of your joints are affected more than the other joints. Maybe you can lift some weights for those joints that don't have arthritis or that you can easily do. I'm not asking anybody to become Arnold Schwarzenegger, but a little bit of resistance training will go a long way. Even if you gained a pound of muscle, you can burn more calories, you'll have more energy, you'll feel better. But that's pretty much it for my talk. I'm happy I kept to the assigned time, and I really appreciate everybody taking the time to listen so attentively. You guys are a great audience. Thank you so much. Thank you, Donna.
I'll let you take that.
Okay.
Awesome. You know what? I told you guys, like I took some notes here, right? There's some great tips that Dr. Piracha's given us. And I hate this, but I forgot to tell you, I have to have somebody remind me to do this. There were note cards on your table. Those are for you to ask questions. So if you think of a question that you might have for Dr. Piracha, I'm going to hold him up here, and we'll give him a chance to answer any questions. But I mean, bottom line is he gave us a lot of information, and he covered it well. So you may not have any. One thing I wanted to offer, he talked a lot about the grams, and our brains don't think in grams, right? What do they think in? Teaspoons, right? So just a quick equation for you is that 4 grams equals about 1 teaspoon. So when you start reading labels and trying to figure some of this stuff out, that's just a really kind of quick equation that you can have in your head that I like to use. And then he talked about fats, right? And for you, I don't want to pick on the men in the audience, but I'm just going to tell you, my husband thinks that even if it's a vegetable and you fry it, it's okay. Not okay. Fried green tomatoes, as much as I love the fried okra at Rib Tickler, like those, it doesn't count. Right? Like when you fry it, we take all the good stuff out of that. So just be really careful about that. Great education, Doc, on the glucose and how it actually works in the body, because sometimes we hear all these words and we don't really know what they mean, right? And so that educator part of him came out and really helped us understand that. And just looking at the fiber content, you didn't really talk a whole lot about that, Doc. Do you want to say anything about that? Because that's really super important as well, to make sure that when you're looking at the amount of sugar that's in something, that you're also looking at the fiber content, because it helps it become more low glycemic.
Yeah, basically, fiber is extremely important, and it has many different benefits, like Donna mentioned about the glucose and stuff. Also, it's very important for your bowel health. The problem is that constipation is also one of the big problems that I see all the time. And exactly, again, it goes the same way. We spend, if you look at people who came before us 100 years ago, they used to walk much more than we do. One of the most important things that will make sure you don't develop constipation and you have a good bowel habits is to make sure you walk. But since we don't walk much, majority of the population gets constipation. Fiber is very important to make sure that you have good bowel health, and also if you eat more fiber with your meal, that will make sure that again your blood glucose is not going to spike as high, and if you have diabetes, that's going to have a lot of benefits for you.
Awesome, thank you. And then, lastly, he talked about the protein, right? And that was a big revelation for me. I don't eat a whole, I found as I've gotten older, I wasn't eating enough protein. And there's some pretty simple formulas. Again, he gave it to you in kilograms. I don't think in kilograms. So I'm just going to tell you, if you Google it and you figure out what your body weight is, then it's a really easy calculation to figure out how much protein you probably should be eating a day. And all you have to do is kind of be a little bit aware, and you'll realize if you're falling short, and then just making sure that you're getting good quality protein. So we did come up with a couple of questions. Are you ready?
Sure.
Okay. Let me see. I'll pick the easy ones first. So a lot of these are about just food choices, okay? So thoughts about corn tortillas, are they any better? I think there's, again, some misconceptions out there. Flour tortillas or corn tortillas is a big discussion in our house as well. Any thoughts about that?
Yeah, so basically this has been looked at a lot about different types. There's a big school of thought about glycemic index, that there's some if you eat wheat bread versus white bread, your blood glucose level with the wheat bread is more friendly than white bread, and basically the glycemic index is small, your blood sugar will not go that high. At the end of the day, I look at it as a whole. So, even if you eat, there are some benefits of eating wheat rice or wheat bread. Similarly, there may be some benefits between corn tortillas and flour tortillas. But the issue is that you're still getting 4 calories per gram of carbohydrate. So the point is that if you eat something that's not tasty, just because you think that it may be more healthy and you can't stick with it for a long period of time, I would rather eat something that's tasty, especially if it's providing me with the same number of calories.
Absolutely. Yeah. When you talked about the cauliflower pizza, the crust, I started looking that up, and guys, they're like, it's amazing how they market things to us, right? And we'll buy them and eat them because they make it sound like it's going to be healthy. Well, when you start digging into cauliflower pizza crust, it may not have some of the stuff in there, but it's just not all it's not all it's cracked up to be.
Yeah, you have to look at the whole food label, make sure there are no other surprises. Like salt. You may be eating the cauliflower pizza because you think that you're not getting enough carbohydrates, but guess what? It had like a ton of salt in it.
Yeah, absolutely. So, Doc, what do you think about eating based on your blood type?
So that's another thing that has been looked at, but I'm not personally aware of like any big studies that have been done that will show that there's any significant benefit with that. It could be possible that people with certain blood types may have some additional benefits by eating some particular type of micronutrients, but for the most part, you have to stick with your daily requirements and make sure you stay within them.
Okay, and then who has an air fryer at their house, right? So what do you think about the air fryers? Is that something you're familiar with?
I think it's definitely much better than using the regular frying methods. Obviously, we always suggest that you don't eat fried food, which in itself is not the best option, but if you definitely have to, an air fryer would probably be much better than frying it in oil like we used to do traditionally.
Yeah, I think so. What about mayo? Texas. We eat a lot of mayo.
You really have to look at how much saturated fat is in there. They say mayo and light mayo. I have my reservations. Make sure that it falls within your daily amount of calories. But I will tell you that's not the best fats that I would like to have.
Right, so we got to make our choices, right? And then there's a lot of talk also like between the plant milks and dairy, and so this particular question I think they're looking at almond milk versus skim milk.
Right. Again, if you go back to it, it's all about if you have some almond milk, then obviously we talked about almonds are one of the nuts that you can have, which are one of the healthy fats. But at the end of the day, it all depends upon how much you are consuming it and what exactly is in it. For a certain group of people, like one of the most common things that a lot of people have bariatric surgery and gastric sleeve and stuff. A lot of bariatric surgeons recommend almond milk. But at the end of the day, it's fine. Just make sure you look at the micronutrients and make sure you're getting a balanced diet and it's not heavy on one micronutrient that's going to throw off all of your calculations for your daily quota.
All right, 2 more questions. And this one's about ghee. Do you know what ghee is? Clarified
Yes.
better? Okay. Simple question, good or bad? What's your vote?
Bad.
Bad. Ooh, bad. All right. And then what's your stance on the keto diet? So I think you've kind of spoken to this a lot, but in particular, especially in relation to managing cholesterol levels.
Yeah, keto diet is good. A lot of people are using it successfully. There are only 2 points I would like to mention. Make sure you're hydrating yourself, you're drinking enough water. What happens is that what happens in a keto diet is that you don't metabolize glucose for energy, you utilize keto bodies. Sometimes that can cause dehydration, so make sure you're properly hydrated. And the other most important thing is make sure you're eating enough protein. Because the biggest issue with keto diet is about losing weight and losing fat, and a lot of people forget to eat enough protein. So make sure you have enough protein.
All right, let's give it up for Dr. Piracha. Thank you so much.
Thank you.
Appreciate your time.